Stephen Pasquini here from Smarty PANCE. I am going to show you a demo of how I am using Smarty PANCE for my PANRE-LA and how I recommend you use it for yours. I am in quarter 6 of my PANRE-LA and I have a new search functionality that I want to show you. We just launched it last week and I think it's going to be a real game changer as far as content area specific search, and I'm going to show you how to use that here. So I have a split screen setup here. I'm actually using 2 monitors. If you have 2 monitors, great, but you can do this on 1 monitor too. As you can see, I have Smarty PANCE on the right, and then here on the left side of the screen, I have a demo that I've made in Canva. These are just screenshots from the NCCPA blueprint, and I have edited them and created my own questions. These are not real PANRE-LA questions, sorry, but I will show you how to do this using these demo slides here. So let's pretend this is our actual PANRE-LA exam and we can go through a real question. So here we are at Smarty PANCE. Let's go ahead and log into the website. You click up here on the right, you enter your username and password, you log in, you come to the members launchpad. What I want you to do is focus on one thing here, and that's the blueprint. So to get to the PANRE-LA blueprint specifically, I'm just going to click here on this blueprints tab. So I click here, and then I go to the PANRE-LA section here, and I can click on the PANRE-LA blueprint. Now there's a PANRE search and sort tool and the PANRE rapid search. Now I'm going to avoid these for now. Okay, this PANRE rapid search also still works, but let me show you the new functionality that I think blows that out of the water. So I'm going to click here on the PANRE-LA blueprint, and here I am with the blueprint. Now this is the starting point everybody should be on when they open up their PANRE-LA exam. So let's pretend you've already logged into the NCCPA website and you've started the exam and you're now at that question 1 or whatever question you are at, introduction. The most important part here is this content system, this content area. Okay, so what I do is I look at the content area and then I go to that content area on the actual PANRE-LA blueprint, because I know that they're only going to be asking questions within this blueprint. So I'm going to completely narrow down my differential. Now there's a couple ways to get there. The easiest way to get there is on these links here. Now this is the whole blueprint, so you can scroll down and find all the different systems. But what I do is I look here at renal system, then I click here on renal system here to take me to that specific area. Now the key, the new part to Smarty PANCE, which is really amazing, are these search bars here that exist above every single system. So here's renal system, search renal, PANRE, it's PANRE-LA renal, and here's PANRE reproductive. Now this is going to allow us to search just within that system. So we're on a question for the system, we're going to search just within that system. You're not going to search all the Smarty PANCE, all the different PANCE and PANRE topics. You're going to just search these topics within the PANRE-LA. So you're going to get much more custom results, better results using this tool. So let's go ahead and walk you through a question. And after I do this one, I'll take you through a couple more samples as well, just so we can really nail these things down. So here we are at question 1, introduction, content area, renal system. I look at renal system, I've opened that up, and I'm looking at the options here. Now, sometimes if there's a specific topic that I want to read more about, I might click into it. Say, I'm like, you know what? I really don't remember rhabdo. I go in, I click rhabdo. I might look at the clinical vignette, pick up some keywords, elevated creatine kinase. I might look at some treatment options here, fluid resuscitation, diagnostics. Here we have that urine sample that is tea colored, right? Myoglobin. Keywords, I might look at pearls, do a quick brush up, go back, done with rhabdo, and maybe I'll go and look at other things, chronic kidney disease, acute kidney injury. Those are big topics, but if you want to take a quick look, if you're not feeling good about a topic, you can do a search. You have all the time in the world, right? But let's forget about that. Let's just see how our system works in the real world and go ahead and answer the question. So here we are at question 1. Let's go ahead. We click begin question, and it's going to open up this next page that you're probably very familiar with. Now, test taking 101, I'll walk you through it very briefly. I always read the lead in question first, okay? So I look at the question right away, I go to the lead in. The lead in is the very last sentence, right? It is the question. I've highlighted this for this example so I can demonstrate this for you. So right away, I look at this. Which of the following is the most likely causative agent of his condition? Now, before I even read the question, I'm already kind of looking at what the question's asking for. I'm going to go through here quickly and look at the answer choices just so I can get familiar with this. Which of the following is the most likely causative agent in this condition? Okay, familiar. I see we have some options here. Now, next, thing I do is I read the first sentence of the clinical vignette. So I go from the end to the beginning. I've highlighted here in green. So let's go ahead and read this together. A 35-year-old man presents to the clinic with complaints of fever, chills, and severe left flank pain for the past 2 days. Now, with just those 2 sentences and my renal system blueprint, I can already really start to come up with the answer, or at least what the differential is. And honestly, sometimes you don't even have to read more. I always do, but you don't always have to. So flank pain, fever, chills. I'm looking at these options here, right? Is this rhabdo? Maybe, but probably not. Chronic kidney disease, no, this is acute. Renal cell carcinoma, I'm thinking more, painless hematuria. But we have flank pain, fever, chills. This is already looking like pyelonephritis. But let's go ahead and read the rest of the question. Now, when I read a question, I'm always looking for clues, right? So keywords that are going to help me get to the diagnosis. I've highlighted these here in red. So let's go ahead and read the rest of the vignette. He describes the pain as constant, radiating towards the lower abdomen. Additionally, he reports with nausea, there's a good keyword, and burning sensation during urination. His vital signs are as follows. Temperature of 102.6 degrees Fahrenheit, so he's febrile, like they said in the beginning, that opening sentence. And physical examination reveals tenderness at the left costovertebral angle. That's a good clue, right? Urinalysis results indicate presence of white blood cells and bacteria. And here we are again at the lead-in. Which of the following is the most likely causative agent of this condition? Now, you might already know that the answer here, I'm thinking it might be E. coli, right? But maybe you don't. So let's go ahead. I'm thinking it's pyelonephritis. Now, I could click on pyelonephritis and go right into the lesson. And, I could see, oh, here we go, fever, chills, nausea, flank pain. Boy, that really sounds like this patient. But say I'm really not sure, and I want to just do a keyword search. So say I put in flank. If I put in flank right away, pyelonephritis, renal cell carcinoma, so that gives me a great idea that this is what it is. What if I put in CVA tenderness? I put in CVA right away, pyelonephritis comes up. So that's just in the rapid. Now, if I put in, say I did flank here like this, and I click search PANRE, it's going to take me to this system smart search page, which just searches renal, and it gives me a very quick breakdown of clickable options that I can look into. So what's really nice about Smarty PANCE is in this, on the smart search now, it gives you this fever, flank pain, right? It summarizes it, CVA tenderness. Wow, that is this patient. And here's the answer, organism E. coli. There you go. Wow, look at that. Now, I might not go off that. I want to go into that lecture and just maybe check the topic. I can do this all very quickly. I click pyelonephritis. Okay, like I said before, here's the vignette. Looks very much like this patient. And where could I find the most likely cause? Usually things like causes are going to be in the pearls and maybe in the diagnosis section too, but let's go ahead and click pearls here and see what we got. So fever, chills, nausea, flank pain, all highlighted, CVA tenderness highlighted. And there we are. E. coli is by far the most common and causative agent, 70 to 80% of cases. There's our answer right there. I can choose this and I can move on. Now, if you want to do a search outside of Smarty PANCE, you certainly can. If you're not sure about an answer, I have links down here, which I really love, and they'll take you to resources. I like UpToDate, although UpToDate is very big and it's hard to get, refined results quickly. But you can click Merck Manual here. Merck Manual is actually really quick. Sometimes you can find things. And actually, if you use a function that I love, this is Command or Control F, you're going to get a search bar up here. Now, if I put E. coli, actually, look at that. I'm on their website, on Merck here. I don't even get E. coli, so I have to kind of go down. Let's see if Merck gives me the answer. Here, infection localization. Yeah, I'm sure it's in here somewhere. But you can see how hard it is to find answers sometimes on pages like this. I wonder if I just put in coli. Whatever it does, it's going to highlight. There we go. If I put E. coli, you start to see I just put in coli. You get some answers. Here we go, normal growth, strains of E. coli, specific, enteric, usually gram-negative bacteria. Here, causes, E. coli here again. So this is giving me some ideas. UpToDate definitely probably will have that answer, but you have to search hard. The good thing was when we did a search on Smarty PANCE, boy, oh boy, there was our answer. So you can go ahead and click submit. You'll find out that that is our right answer. I won't walk you through any more of that. What I am going to do is go through a few more options that I've teed up here. So I have this here in Canva. Let's close this here. And here are a few more demo questions that we can do to do some practice. So let's go back to our blueprint. Now we can either click back, and that'll take us back to that smart search, or we can click blueprints again. And here we are. We can go to the blueprint here. Okay, we have our next question. I know it says question 1, but this is question 2, question 3, whichever one we're at. So let's take an example, pretend we're on a hematologic system example. So here we are at hematologic system. So I'm going to go click hematologic system. So here's all our diseases, disorders. Maybe I want to take a quick look through, but I'm feeling ready. I want to begin the question. Let's go ahead and click begin question. I click begin question. And here we're at the question. So let's go through. Let's use our steps like we used before. Let's go ahead and read the leading question first. This patient's symptoms are most likely caused by a deficiency of which of the following? Okay, so we know it's the deficiency in one of these vitamins. So let's go ahead and read that first sentence. A 42-year-old man, okay, he's an older man, fatigue, weakness, and numbness in his hands and feet for the past 6 months. So numbness, that's a key there. He follows a strict vegan diet. Vegan diet is probably very important. They never give you information in a vignette unless it is important. So he's a vegan. He's got weakness and numbness in his feet. Oh, here we go. Physical exam, pallor, smooth tongue, decreased vibratory sensation. Laboratory tests show a macrocytic anemia. So that has narrowed down my differential a lot. Now, I'm thinking this is probably B12 deficiency, but say you don't know. Say you're not familiar with the presentation of B12 deficiency, or you just forgot. What happens if we put in, I'm curious what's going to happen, vibratory here. There we go, vibratory, vitamin B12 deficiency. How do you like that sentences? What if we put in smooth tongue? Let's see. There we go, vitamin B12 deficiency. So just by searching some of the keywords and the clues here, you already will have an idea of what the answer is. So what if we just did a search here? Here we are in the Smarty PANCE hematologic system search, smooth, beefy tongue, neurological symptoms. There we go. Look at that. He had numbness in his hands and feet. That sounds a lot like this. Macrocytic anemia. There we go. What if I click on the lecture? There we go. Read the pearls. Diminished deep tendon reflexes, loss of proprioception, strict vegans. Okay, now I'm pretty sure this is definitely vitamin B12 deficiency. I click that answer, submit my answer, and guess what? I am totally right. Okay, let's go on to another example. Let's go into reproductive system here. So let's go back. You can click back twice. That'll actually take you back here. Now you can scroll back up to the top here, and just like we did before, we get to our question. First thing we do is we go to the content area, and we go to our content area here on our blueprint page. Reproductive system, I'm going to recommend you click here on reproductive system, and we do a quick look at all the reproductive system disorders that are possible and that are available to us. And we're going to focus on the reproductive system smart search tool right here. Okay, so we don't have to leave this page. So here we go. I'm ready. I've kind of reviewed these. I'm feeling confident. I click begin question. Open up the question. Let's go ahead and do our normal steps. Read the lead-in question first. Which of the following, or lead-in sentence first, which of the following is the most likely diagnosis? Okay, so we're looking at a diagnosis. Quickly read through here. Okay, it's reproductive, so these are all reproductive options. Most of these correlate with diseases here, so we have to narrow down our differential. So let's go ahead into the first sentence. 31-year-old female, so she's young, a young woman, 31. She has cyclic pelvic pain that has been increasing over the last 8 months. She reports significant dysmenorrhea, heavy menstrual bleeding, and dyspareunia. She uses oral contraceptives for birth control. On physical examination, her uterus is retroverted and fixed and has a palpable adnexal mass on the right side. Her serum pregnancy test is negative. Now you can go ahead and look at your answer choices. Now say you have no idea what the answer is, but you want to do some keyword searching here. So, look, she's got a retroverted cervix. What happens if we do, retroverted uterus here? Oh, sometimes you have to spell it right, and that can get you retroverted. There we go, retroverted. Endometriosis comes right up. Wow, that's right there. What if I put in dysmenorrhea? I'm curious what comes up. Dysmenorrhea, endometriosis right there too. Uterine disorders, ectopic pregnancy, and that does come in there. That's not even an answer here, but say we click dysmenorrhea. What if we just had that part of that word here, dysmenorrhea? All right, here we go. I'm thinking this might be endometriosis. Let's go ahead and click in here. Of course, you can see the topic summaries here, things that we have that might be helpful as you go through this, ectopic pregnancy. Let's go ahead and click on endometriosis here and see what comes up. If you're not sure, you can read the clinic vignette. I like these because it kind of tells you, what what this is going to look like. They match, you're onto the right thing. So here's a retrovital uterus right here. This patient's really looking like this one, young female patient. She had dysmenorrhea, painful intercourse, difficulty defecating. Of course, those aren't all. They're not going to give you all those in the vignette. And click on pearls here. We see what we have. Endometriosis condition, type of pregnancy, menstrual cycle, dyspareunia, dyschezia, infertility, fixed retrovital uterus. You know what? This is probably definitely the answer right now. You can go through and you can test yourself too. If you wanted to look up some other diseases, say you weren't sure if this could be pelvic inflammatory disease, right? So what happens if we put in PID? System knows these short keywords. If you put in PID, it'll show up. If I click PID, this is an infection, fallopian tubes, gonorrhea, chlamydia, cervical motion tenderness, pelvic pain, fever, vaginal discharge. None of those are here. So say you're not sure what the answer is, you can search some of the other topics too and know, I'm pretty confident this is endometriosis. I choose that as an answer, and guess what? I'm correct. All right, let's do one last question just to make sure we have this down. So I went ahead, I'm in my PANRE-LA exam, and I clicked on next question. I'm looking at the content area. The content area is dermatologic system. I clicked dermatologic system on my blueprint. I came down to the appropriate section. I've looked through all my options. You can see there's a lot of options in derm. Maybe I reviewed the ones that I'm not so familiar with. I've gone right back up here, so I have the search tool in place, okay? And I'm ready. I'm just gonna go ahead and begin the question. So I'm clicking begin question. Here we are at the question page. We read the leading question first. Remember, this is always key if you're not doing this already. Which of the following is most likely to improve the rash? So we know this is about treatment. I quickly look at my options here just to familiarize myself with them. Then I start by reading the first sentence of the vignette. A 9-month-old boy, we know we have a young boy, presents to the clinic with persistent diaper rash. So we know this is diaper rash. Let's read on. His parents have been using over-the-counter diaper creams without improvement. The rash has become more red and some areas have merged into larger plaques. On examination, the erythematous rash is most prominent over the buttocks and perineal area. Several lesions have coalesced into macerated plaques, and there are scattered, beefy red lesions with satellite pustules. So this is a specific type of diaper rash. And what if you don't know what this is? What if I just put in some symptoms here this patient has? So I put in beefy red, and I put in diaper. Whoa, candidiasis. So this is a diaper rash that's been complicated by candidiasis. So what if I just go ahead and search here? So I put beefy red diaper. I see it comes up as candidiasis. I click on a candidiasis. Here I am with the Smarty PANCE lecture, the Smarty PANCE lesson. I read through this. Go ahead and look at the pearls. Candidiasis can cause several types of rashes. Vaginal candidiasis is the one we think of most likely, esophageal, oral thrush, of course, intertrago. And then here we are, diaper dermatitis. So we have diaper dermatitis. So candida can affect the diaper region of babies, causing a diaper rash with redness surrounded by scattered red spots and satellite lesions. Okay, there we go. That really fits with this. So this is candidal diaper rash. So let's go ahead and look at the treatment options. We'll go ahead and find the appropriate section here. And here we are at diaper dermatitis complicated by candida. Look at the treatment options: nystatin, clotrimazole, miconazole, ketoconazole. Let's look over here. Which one fits? There we are. The answer is nystatin. So there you have it. There is a not so brief but detailed demo of how I use Smarty PANCE on my PANRE-LA. And I want to show you briefly too, you'll see these other search bars, and this search bar here, for example, searches all the content on Smarty PANCE. So PANCE, PANRE, ER, EOC. For example, if I put in beefy red, it's going to populate all the different topics. If I click search, it's going to take me to all the different topics on Smarty PANCE throughout the website that aren't specific just to the PANRE-LA blueprint. It all work because the PANCE and PANRE, there's so much crossover, but it won't be quite as good. And another thing too, if you go to blueprints, and I have this PANRE rapid search tool here, and this also will do the same thing. So if, say, you put in beefy red here, you're going to see it's actually going to give you two options. It's actually going to be more streamlined, but not quite as good. as the other search, but it would work. And you can search the PANRE and you're going to get options just as well, but they're not going to be quite as specific. Maybe this isn't the best example, but you can imagine that sometimes the questions get much more complicated and you're having to search more specifically. And one last thing I want to show you about Smarty PANCE, if you're on a question, like say for example, you're on a question on PDA and you don't see the answer in Smarty PANCE. Again, I really like these links here, Merck Manual, up to date. You can click up to date. If you have up to date, it'll take you to the specific page on that and you can do searches here. So say you were looking for treatment and one of the treatment options was indomethacin. Here we're on clinical manifestations and diagnosis. You're probably not going to get treatment. So say you go into PDA and let's see, you have management, clinical management, diagnosis. Here we go, adult management, term infants. Say you click into here and say you think the treatment is ibuprofen, indomethacin, and you start to search and Command F, it's going to highlight topics and go right to them using that function. So it'll give you treatment here too. So if you're not sure, you don't find the answer, I love Command F or Control F, depending on what type of system you're on. Control F on Windows, Command F on Mac, and then you're going to go right to these topics and you can highlight them there too. So that's a little bit of a tip. I use that a lot when I'm taking my PANRE-LA. So I hope that all helped, and make sure to reach out to me if you have any questions, and good luck on your PANRE-LA. You are going to do amazing.